Mad and sad.
Very high-risk behavior, walking on glass-top tables.
Troublemaker.
She can go off from 0 to 10 in a second.
I feel like I want to hit somebody.
Baby, do you understand me now?
One day he told me, I just want to die. I'm going to commit suicide. And to hear that from your 9-year-old, it's not easy.
Sometimes I feel a little mad. Oh well, don't you know that no one alive can always be an angel?
I was losing my mind. I knew I didn't give him respect. And it was very, very hard for me. So I cried inside when I did that too. I don't want to do anything bad to my family.
Please don't let me be misunderstood.
More than 14,000 children in Collier County may have a mental illness.
80% of those children are not receiving any mental health services or support. That is more than 11,000 children in Collier County who are not being helped.
Without help, the results can be devastating.
Collier HUGS, Health Under Guided Systems, is a community-based mental health initiative to provide early identification of mental health problems and ongoing navigation with families to secure the long-term services they need.
When the child is in a wheelchair or is blind, it's an illness that you can see, but a mental illness is something that they can't see. So they don't understand that the child wants to behave and just physically and emotionally and mentally can't.
Every child deserves this mental health screening. Just like they receive a vision screening or an oral health screening, there is no difference.
Early intervention is very important. It allows us to do a proper assessment and get these families and the children to the right resources. And of course, you're averting a potential crisis. That happens. But also what you're doing is you're assessing the strengths of these children and their families, and you get them on the road to mental health and wellness.
I have to do better, and they tell me that I need to do better. And everyone's now calm, and anytime we get mad, we don't hurt each other.
I do believe that she would have probably, more than likely, failed school, got into trouble with the law, or worst case scenario, suicide.
It is easy for a child to fall through the cracks of a complicated system.
I am most proud to say that 3,000 children have been screened, and out of those 24% that needed help, we have successfully engaged 98% of those families.
This is, in essence, a network, all working together and all connected through a system navigation that will help guide a parent and a child through the various ups and downs of getting services and of mental health.
As navigators, I think our primary job is to be able to help the family collaborate between the school and the therapeutic interventions so that everybody is on the same page.
The individuals that I work with, the families that I work with, are able to walk with a team of individuals that are working with them. And not only do the families feel like there's a team on their side, I feel like there's also a team on my side as a clinician. I'm not working by myself.
When I start coming to NAMI and realize I wasn't by myself, there were so many other parents. There's a lot of kids like this, a lot of kids.
Yeah, I did feel alone before, but when you guys helped me, I'm not alone. I have friends here too, and I have friends at school. Everybody helps me, and now I'm gonna help them a lot too.
Children that have a mental illness or a mental health diagnosis are children first. They are not the schizophrenic. They are not the bipolar. They are Sarah. They are Brian. They are John. They are children first. They need to receive the treatment and be treated with the respect that they deserve.
And no one goes through the process alone.
Do you understand me now?
It's so difficult when your child has a disability. And to know that there's somebody that's going to help you through this, that's going to give you direction and guide you, and that cares and that's going to provide support, it's just invaluable.
Please don't let me be misunderstood.